more about why this hair thing was such an important, emotional, sticky, difficult topic to broach, and why it was so important for us as black dermatologists to take the lead on helping all women, but particularly black women, deal with hair loss. You know, and what it boiled down to that I figured out was that hair equals power. You know, women get their strength from their hair, their sense of beauty from their hair. They're taught from a very early age that, and it's even in the Bible, I believe, that, you know, strength is in hair. So these are the most common conditions that patients present to dermatologists with, and I'll read them: acne, eczeama, pigmentary disorders, seborrheic dermatitis, alopecias, fungal infections, contact dermatitis, warts, tinea versicolor, and keloids. And of the top 6, 3 of them deal with the scalp and hair. So it's something that, you know, is very prevalent. It's something that drives patients into the dermatologist to see us for these problems, and can also help bridge us into talking about other things. But, you know, an emotional attachment to hair is something that I think is unique to African Americans. I don't think that other cultures really have that same connection to the appendage that grows out of their scalps. There have been books written on this. There's one called Hair Story: Untangling the Roots of Black Hair in America by a woman named, 2 women, Ayanna Bird and Lori Tharp. And that book really went back to the roots of, no pun intended, this issue back to Africa, where certain tribes would allow only the royalty to wear their hair in certain ways, being, you know, larger and more grand to signify their importance in society. Tender-Headed, a comb-bending collection of hair stories by Pamela Johnson and Juliet Harris, also looked at the issue, but more from an American point of view, and the cultural attachments that we have attributed to hair. They talk about the rites of passage when young girls first start to get perms when they're 13 and 14 years old. They discuss the intimate bonding that goes on among black women in hair salons. And there have even books about this: Hair Matters, Going Natural, and Good Hair. These are all good books because I think that they highlight the evolution that we've gone through, where, you know, we're starting to accept the natural state of the African texture hair, and not necessarily fall into the pressure of trying to achieve some European standard of beauty. Even Hollywood has gotten in on the action. Hair show, beauty shop, and you'll see in these movies, beauty salon, you know, they know what entertains us, where people go to spill their deepest, darkest secrets. So, and then this is just a collage of some different celebrities with different hairstyles. And, you know, if you would have done this back in the 40s, first of all, there wouldn't have been very many African American women that we could have had up here, but they would have all had the same type of hairstyle. So it's good that we're moving beyond these tight confines that we were bound by in the past, and allowing our natural beauty to shine through, and really embracing that and owning it. So now we're going to get kind of more into the nitty-gritty of it. Alopecia, does anybody know what that word means? Loss of hair, right? So it's very basic. And, you know, patients come to me and they've gone to somebody else, and I ask them about their hair if they've seen somebody else about it. And they tell me, yeah, the doctor said I had alopecia. Well, we all know that when you walk in the door. You really have to get to the root, right? Alopecia. That's a very, very broad term. There are about 50 different types of alopecia. So you have to get to the root of it, because if not, you won't be able to specifically treat the problem that is causing the hair death to come out. So it's from the Greek for loss of hair from the scalp of the body. Very non-specific term. And this is probably my favorite slide. I'm really heartbroken that everybody can't see it. But there are 2 white people reaching out to touch black people's hair. Who's had somebody do that to them before? Yeah, they always try to sneak it in. My little boy is 2 years old and he runs around. And they try to act like they're just patting his hair, but I know what they're doing. They're trying to sneak a peek, trying to see what's going on. That you know, it's different, right? We're the only race of people that has hair with that texture. And it's a novelty, and it's something that we should celebrate, but it's something that makes us unique, a subject of curiosity, and a little bit intriguing. So there are differences if you look at the different races in the structure of the hair and why the hair looks phenotypically the way that it does. If you take a hair from a white person, an Asian person, and an African American person, cut it on cross-section, right? So you pull the hair out, This is the hair, and you cut it here, and then you look at it right here on a microscope. An Asian hair is perfectly round, so it's extremely straight, has no bends. And a typical Caucasian hair is going to be more oval in cross-section, and then our hair is flat or elliptical. That allows for it to curl, okay? And this is going to be discussed more in detail in a bit. These are some really good electron micrographs of hair under a very, very strong, powerful microscope that shows the knots and the twists that occur naturally in African texture hair because of the curling and the curl patterns that we have. And if you start to look at this, you'll see that when that hair starts rubbing together because of the knots and the twists, it forms points of friction, and that will lead to breakage. I'm not even going to this one because you can't really see it. But the unique properties of African hair: tightly coiled, flatter cross-section, longitudinal fissures. So along the hair shaft, there will be these little grooves that make it less strong and more prone to breakage. Spontaneous knots that occur, inherently dry, and there aren't a lot of elastic fibrils. So where another race has hair that can bounce back and spring back, our hair will just break. So does African hair grow more slowly? Good. Good answer. So hair length is determined by, it's genetically determined, right? There's an anagen phase, it's a growth phase, and just like your eye color is predetermined and the size of your feet is predetermined, your anagen phase is predetermined. So your hair is going to grow to a certain length, and then it's going to start to shed. It's going to go into what we call a telogen phase, which is the resting phase, and the hair starts to shed. Only 10% of hair is in telogen at any given time. But yes, certain people can only achieve a certain length of hair. Now that is only part of the story, however, because if the hair is breaking and doesn't get a chance to achieve that full anagen phase, then it's going to appear that their hair isn't growing. People come to me all the time, my hair is not growing. I said, all hair grows. What do you mean? All hair grows. You have to treat it right so that it doesn't break on the other end. There have been studies on this where they looked at the amount of knots, the dryness of the hair, and the rate of breakage on the end, and they found that some people treat their hair so poorly with all the chemicals and the heat and the traction that they're breaking it at a rate that's faster than it can grow. And it amounts to basically a daily haircut. So this is the most common structural hair abnormality. It's called trichorexis nodosa. It's a fancy word for hair breakage. And this is something that you can acquire, okay? This is something that you can grow into. But basically on the outside of each individual hair, this is the best prop for hair. The cuticle layer, the outside is laid like shingles. So when those shingles start to fly away in your roof, what happens? Your roof sustains damage, right? The water gets in and it makes it, it's more prone to damage, it's wet, it's just not good. Same thing with the hair. If that outer layer isn't intact to keep all the bad things out and all the good things in, then you're going to start to have problems. People who suffer from hair breakage tend to fall in one of three categories. Either a long history of chemical relaxers, right? So a chemical relaxer typically is supposed to be applied only to the new growth, but we know that that's not an exact science, so there's always going to be overlap, and every time it's applied, it's going to make the hair more and more fragile and more damaged, so that it's more prone to breakage. That's the first group, excuse me. Then there are people who have recently decided to start chemically relaxing their hair, chemically treating their hair, and it sort of shocks the hair, right? It's been used to not having this foreign substance, and now it does, and so it's more prone to breakage. And then there's virgin hair that, while it doesn't have the outside environmental factors making it less strong and more weak, when you work to comb it and to manage it, that increased mechanical action can cause breakage, just the same. So some things that we know can contribute to hair breakage: relaxers, scratching, heat, traction, excessive dryness, and weave. So it's really important to always have a good moisturizing shampoo. A typical patient with hair breakage is going to have hair of uneven length, It's going to be easily fractured when you break it and look at it under the microscope. Instead of a nice clean break, it looks kind of like broomstick hairs, they call those. And that's how they diagnose Trichorexis nodosa. So if you come to my office and I pull some hair and send it to the lab, that's what they're going to show me to let me know that you have acquired this problem that makes your hair more prone to breakage. And there are some treatments that you can do, but of course prevention is always the best. So that kind of closes out the hair breakage section. I've decided to break it up and do questions as we go. Does anybody have any questions about hair breakage? So reversing hair breakage, right? Hair rest is a good way to do it. So you want to give your hair a break. If you're coloring it, if you're relaxing it, if you are, if you carry your flat iron in your bag, do not come and tell me that you are not putting heat on your hair. I know women who do that. Every time they get to the restaurant, they have to go to the bathroom to refresh their dew. So yeah, there's a vitamin that you can take as well, and there are substances that contain an ingredient called dimethicone that will help to erase the damage that is done by the dryness and the wrong products, and it will help to get those shingles back in order. There are leave-in conditioners as well. Trimming your hair is a good way to get it under control. If you want your hair to grow, you have to trim it. The hair that's the longest has been around for the longest time. It's weathered the most, and it's prone to being the most vulnerable. And if you allow it to affect the rest of the hair, then it will. Yeah, dimethicone. So that's in. There's a couple of products. One is called BioSilk by. The brand name is BioSilk, and it's a hair serum. And there's another one by John Frieda called Frizz. I'm actually developing something that you put on after you wash your hair that will, prevent you from having to do this every day. It's B vitamins, typically biotin. You have to take it in much higher doses than are available over the counter. Carrot Care is a good one. Mizani is a good one. Oh, sorry. Somebody asked about the vitamin. Biotin. It's good for nails and hair, all skin appendages. And the second question was about moisturizing shampoos, right? So you always want to get a shampoo that's FUBU, for us, by us. The Pantene is not good. The Relaxed and Natural, they tried, but they just didn't quite get it. Once a week. Once a week. Not twice a week, not once every 2 weeks, once a week. The next problem is called traction alopecia. Now everybody knows somebody, and don't look at your neighbor, who is missing hair on the sides of their head, right? And it's not their fault. It's like that because when they were younger, their grandmothers and their aunts and their mothers pull their hair back so tight, trying to get it straight, that it caused some inflammation at the hair root, made those hair follicles very, very fragile and very, very friable, and they just fall out and they give up. So if you have little girls in your family, save them from going to a dermatologist when they're 20 years old and getting really bad news, because there's not a whole lot that you can do about it at that point. The best way to prevent it is to just avoid the tight braids. But you'll start to see little pus bumps right at the where the hair enters the scalp, and that's how you know that there's trouble with the head. It's always seen in adulthood, and it's caused by an inflammatory process. This is an excellent picture. This is an actual patient who is, her braids were so tight, her scalp was just begging for help. Initially, if you get it when it's in its infancy stages, you can reverse it. But if it gets to the point that it's slick, it's going to be very, very difficult. Associated with pigtails, braids, hair weaves. This is an interesting case that I saw. This is a Russian girl, I believe. It was a study of this woman who, 23 years old, had been wearing her hair pulled back really tight so that she could get a brow lift. Yeah, there's Botox for that, ladies. And she had severe alopecia on the sides, and she had a hair transplant and did okay. So, any questions on traction dermatitis or alopecia?
Doctor, I don't know if my question is what you just said, but I don't use any chemicals on my hair. I have for the last 6 years, but all of scar hair to show. But I don't know
Well,
why.
yeah, you wouldn't see that. You wouldn't see that with your eyes, though. So the frizziness, you just might need like a dimethicone type agent to help with that, or keratin treatment.
Question.
Yes.
Is there a name for the bumps that you get around the sides?
Yeah, traction dermatitis. The bumps are called traction dermatitis. All right, we're gonna move on to acne keloidalis, and I included this. It primarily affects men, so this is the bumps in the back of the scalp. Yes, it is. But there are a lot of women who have this problem too. We don't really know why some people get this. There are theories that friction from collars or helmets can cause this problem. Also, having your hair cut too short, bacteria do get in there and set up this infection. If it goes on long enough, it's going to cause keloids, and it's going to look very unsightly and can lead to permanent hair loss. So it's definitely something that you want to avoid. It can be treated. We do intralesional injections. We do topical creams. And this is a really serious case. This man, so he was a teacher, right? He's like 27 years old, very nice man. This is when I was at the university. This is what my life was like at UAB. Every day, no easy cases. But he was a teacher who would wear a baseball cap perched on the back of his scalp to hide it. He just let it go and go and go. He had been seeing an elderly Caucasian doctor out in Sticks in Mississippi who had been giving him some cream for years. Well, we sent him to ENT and radiation oncology to debulk. He was really, at this point, he's in the wrong clinic if he's in my office. All right, any questions on that? Seborrheic dermatitis, also called scaly scalp, also called dandruff, psoriasis. Very, very common, something that you grow into, right? It's one of the most common reasons that black people go to the dermatologist. It's genetically predisposed. It can also be impacted by environmental factors like lots of alcohol, high-fat diets. Very itchy, and it can lead to hair loss because it is so itchy. You do so much damage when you scratch your scalp. That's something you should really never do. So it's reversible. It doesn't have to lead to permanent hair loss, but there's a yeast that's involved with this problem. The yeast feeds on oil. Does anybody see why black people would have more of an issue with this? Because we grease our scalps, which is scientifically completely unnecessary. I'm not going to argue with anybody's grandmother, but you have to do that. There's not really a reason to grease your scalp. Not really. You know, okay, right? You put grease on your scalp, you put oil and ointment on your scalp, and it makes it feel better. But if you listen to the science behind it, if there's a yeast involved that comes out and causes the rash, and the yeast feeds on oil, you're feeding the beast. You wonder why it never gets better. It's only better for a few days. So,
Is that something that just started because my mom put all of my hair all my life?
you might be lucky and just don't have seborrheic dermatitis, but seborrheic dermatitis is a very common thing that a lot of people deal with. So if you do, then I would say don't do that. But it can be complicated by hair loss, because of the chronic inflammation, the hair breakage. It can make your scalp thick. When you start scratching so much, your skin's like, wait a minute, I want to fight, so it gets thicker. Infection can set in, and then it can also cause color changes too. So let's talk about some of the things some of the products that you use can have a profound effect on your hair and your scalp. Thick emollients can worsen inflammation like we just talked about. So thick emollients, that's greasy ointment. Increase yeast counts like we just talked about. Gels and spritzes are the work of the devil. They're right under weave, right? Because it dries your hair, it makes it really hard. And then unless you wash it, which you're probably not going to do in the middle of the week, you're going to start combing that dry, brittle hair, and what's going to happen? It's quite gone. Exactly. Plus they contain alcohol. Alcohol dries already dried hair. It burns your scalp if you've been scratching it. So a chronically itchy scalp is not normal. That's like the first question I always ask them when they come in with the scalp problem. And my patients in the room will tell you that for sure. You know, if you find yourself doing this all day, and you're always scratching, right? Patients say, oh, it's just a normal itch. Well, what's a normal itch? Your scalp shouldn't itch. When your scalp is itching, it's trying to tell you that there is something going on that you need to pay attention to. That's sometimes the only sign that you'll get. We'll get more into that in a second. So no need to grease your scalp. Maintain a healthy scalp, because a healthy scalp will produce its own oil. Now you might want to put oil on the hair, because like we talked about, the configuration of African texture hair is different. And in order for the oil to work its way down, it's not one slick little highway. It has twists and curves, and it might not make it all the way down that coil. So yeah, you want to put some kind of moisturizer on your hair, but there's no reason to waste your money on grease for your scalp. Break the cycle. Any questions on that one?
How do you convince older, I don't want to say older black women, because I promise I'm not picking on you. I'm talking about my grandmother, honest to God. Because, I mean, this is a fight every week when she presses my daughter's hair. I literally have to take her hand and I'm like, just this much, that's it, because it's so ingrained in our culture. Oil the scalp, grease the scalp. It's like, how do you convince,
Well, it's easy in the office.
Can you come to my grandmother's house and tell her? She won't believe me.
But yeah, it's easy when they come for a problem and they're looking for help to tell them, not to do something, and they try it and they get success. But yeah, it's true. I mean, it goes back to what we were talking about with, these cultural, emotional, ritualistic type of behaviors that we have going with the scalp and the hair. So it's difficult. I'll give you that. Break the cycle.
So I have to summarize dermatitis, and I normally use the Glover's medicated shampoo and whatever product. So that's not a good idea.
Well, yeah, I mean, if it's working for you, it's working for you. There are many different active ingredients that can treat that, right? There are selenium sulfides, salicylic acid. Your hair is natural, so it's easier for you. But salicylic acid is in the gel spritz alcohol category. So, we'll leave that for our Caucasian brothers and sisters. I like zinc. I like antifungal agents, ketoconazole, that kind of thing. There was another question.
I too have seborrheic dermatitis, and I recently bought some flaxseed oil gel today, and I haven't tried it out yet, but would you recommend going ahead and using it?
Oil gel. That's an oxymoron. That's like jumbo sugar.
I'm sorry, well it's flaxseed. I'm sorry, I think it's just flaxseed gel. It's made by Shea Moisture.
Okay. Gels tend to be dry, and oils they're like opposite ends of the dermatologic vehicle spectrum. So I'm always a little leery when I hear oil gel, because if it has an alcohol in it, then it's probably something you want to stay away from. But again, if you're putting it on your, what do you use it for? Scalp?
No, just hair.
Just your hair. Okay. And your hair is natural, so it shouldn't be a problem. How's your scalp though?
It's way better than it was. I'm on a 3-day. I have to wash my hair 3 days a week with this.
You shouldn't have to do that. We'll talk later.
Okay.
Anybody else? Maintenance?
Yes.
The maintenance regimen tends to be the same thing that you were using, just not as intense. Because there's no cure for seborrheic dermatitis. So it's something you're going to have to deal with. Sometimes I'll tell patients just don't use this as often if it's a steroid. But typically you want to just maintain it with a shampoo and not have to do other things. Somebody else? Yes. Yeah, like Cara Mazzani, Miss Jessie's. There are a lot of good options out there now.
So if you have dandruff.
Dandruff is just seborrheic dermatitis.
Okay, so you don't recommend putting grease on it at all.
I think if you get the right shampoo, you won't have to. All right. So this is the big one, right? This is the one where you sit in church, in the black church, and you look at all the ladies who are losing their hair right up here at the top. And it's really sad. It's really not funny. It's an epidemic. And we're trying to figure it out. So 35 years ago, when black people couldn't get into dermatology, Nobody cared, and they had about 4,000 different names. It's been called hot comb alopecia, chemically induced cosmetic alopecia, follicular degeneration syndrome, progressive fibrosing alopecia. And we've settled on a scientific term. It's CCCA. So central, because of where it starts. Always starts at the same place. That's peculiar right there. Centrifugal, because it spreads out. Cicatricial is another word for scarring, which means that hair follicles are destroyed and they're not coming back. And alopecia, we all learned tonight, means hair loss. So that's one type of hair loss. This is probably the most common type of hair loss in black women. Now the most common type of hair loss overall we'll talk about next, but this is the one that is causing a lot of problems. And it turns into a slippery slope when they wear the weaves, because the weave causes tension, and tension just makes it worse. So chronic progressive vertex inflammation, it expands radially. It itches. That's usually the first sign. If you're lucky, you'll get that sign. If you're not, all you'll notice is the thing. Vast majority of African American women, and for some reason the prevalence is higher in the United States than it is in South Africa. South Africa and the United States are the two areas where people are actively studying this problem. There's a woman there, Norma Kamalo, she's a dermatologist, and she's really advanced the field a lot. And so we're starting to catch up now with some of the work that she's done. But this is all stuff that's come out in the last 10 years, I would say. 3-to-1 female-male ratio. So men can get this problem too. And I see it all the time. It manifests differently, obviously, because, you know, it's more acceptable for a man to have hair loss there, and especially if there's a family history, you might not think anything of it, especially if there's no inflammation or irritation. Hair grows in a counterclockwise forward way. And for men, that's okay. We don't typically go against that. But for styling reasons for women, y'all whip that stuff all over the place. And when you start going against it, you know, you start interfering with the natural pattern of how the hair is trying to grow, and that can cause problems. There's a hereditary component. So there were 2 recent studies that showed, one showed inheritance pattern from the mother, and another one showed an inheritance pattern from the maternal grandfather, but that's still the same line, right? And we know that all hair loss is multifactorial, and that there's really not a reproducible, predictable inheritance pattern that you can point to. So I always ask people to consider all of their relatives when trying to decide if there's a problem in the family with hair loss. And I will tell you this, I see probably between 50 and 60 patients a day, and I see probably 6 to 8 patients with hair loss every day, okay? How many do you think come in and tell me when I ask them if they have a family history? Yes. Nobody has a family history. But then you have to start asking the questions, well, does anybody wear hair pieces? You know, you have to get to the bottom of it, because this is coming from somewhere. And I ask because it's important for that person, but it's also important for us to collect this information so we can find out more. All right, rare in children, but I've seen it as young as 21. Okay, so there are some things that this problem has absolutely no correlation to, and this has been clinically proven or studied. Keloid formation. So if you have keloids, that does not increase your risk for getting this condition, even though it is a scarring problem and a keloid is a scar. Hot combs, no relation. Hormones and acne, they looked at that too. No relation between hormones and acne and hair loss. Relaxers, no correlation. Very interesting. But if you think about it, it kind of makes sense. Because if I tell you that it always starts at one area, the perm is all over, right? So why wouldn't it affect the whole scalp? Also, a lot of people perm, but everybody doesn't get this. So I don't typically encourage people to not wear relaxers. I think that relaxers are an option for people who choose to go that route. I think it's beautiful to be natural, but I think it's wonderful to have options, and I think it's great that, you know, everybody can do what they want to do. When you use a relaxer properly, there is no reason that you can't have one. Let's talk about the things that are correlated. Tension. So pulling, right? Tight weaves. We talked about pull. There's going to be a common thread here. Tight pulling and black scalps are bad news, right? We talked about the traction dermatitis and alopecia, and now we're seeing it come up again. When you look at this problem under the microscope, when you do a biopsy, it looks the exact same as if you were to do a biopsy from the front of a little girl's hair who has lost the hair on the sides. So we know tension has something to do with it. the weaves and the braids, right? All that heavy horse hair pulling down on the natural follicle. I'm very, very anti-weave. I'm very anti-weave. Well, let me tell you why. Okay, who can guess the youngest age? This woman brought her daughter in, and the daughter was having a problem with her scalp, itchy scalp, losing her hair. We were like, man, that's a womanly hairstyle for a little girl. Come to find out, it was all glued in Tress. She was 4 years old. And the mama had the nerve to get mad at me. So, I mean, I see these girls coming in all the time, 16, it's no big deal to have all this hair on their head. And they're just doing themselves a disservice for later. So, that's why I'm anti-weave, because I know the damage it can do. I think it is diminishing the culture of our people, okay? And I think that when we look in the mirror, we should look back and see something different. Metabolic syndrome. Metabolic syndrome is also called Syndrome X. It has to do with being a little bit overweight, diabetes, hypertension, discoloration on the skin, and that seems to be linked more to this than any of these other things that we talked about. And then infections. If you have a bacterial infection or a fungal infection like a ringworm, that can help to trip this over too. So there are certain other conditions that don't seem to have a real effect on this. Atopic dermatitis or eczema seems to improve this condition. Seborrheic dermatitis and contact dermatitis, which is when your skin comes in contact with something that it doesn't like and it sets up a reaction like glue or weave or color. Those things can also trip this over. So this is the first study that this woman, this is another lady, Noruka. She's in South Africa too, but she was the first person to look at if a perm really has any effect on hair loss, or this CCCA problem in particular. And while there was people who got perms tended to have hair loss, but it wasn't a direct link. Does that make sense? It was more like an indirect thing. We think it might have been a confounding variable. There might be something else that people who get perms are doing that makes them more likely to develop the problem. So it's controversial even in dermatology circles, but inconclusive still. So there are some different things you have to consider. Just because you have hair loss at the top doesn't mean that it's this. It could be lupus. It could be female hormone pattern hair loss. This is a poor lady who just waited a little bit too long, but these are some of the options that we have. Hair rest, we talked about that. Shampoos to address the scalp, steroid injections, antibiotics, hair transplants. This is a girl who started having this issue around the age of 25, and this is before treatment. Here at the middle of her scalp, you can see it's just broken, and the scalp was kind of scaly and red. And she nursed it back to health, and about 6 months later, she was back to normal. Is it something she can just forget about? No, she's gonna have to think about it. It's a chronic condition, but at least she was able to save it. So itch is the enemy. Your scalp should not itch, just a reminder. Any questions?
I have a question.
Sure.
I wasn't sure if I heard you right. Did you say that hormones have nothing to do with the hair loss?
That particular type. Remember, there are like 50 different types of alopecia? So it doesn't have anything to do with that, but it has a lot to do with the next one.
But the hormones that we get sometimes, like the hot flashes and stuff, which I get, like my hair started thinning, and I started losing hair everywhere. Then I got the hormone replacement, and it started growing again everywhere.
Well, yeah, that makes sense, because your body doesn't think that it's the age that it is when it has the hormone around. So the normal process would be for those hormones to have an effect on your hair to make it grow thinner and lighter and finer over time. But if the hormone is there to replace, what's been lost, then it won't happen. Does that make sense?
Yeah, I just want to make sure that it's okay to keep getting them because I need them for all
Well, hormones have other issues that I'm sure your doctor has talked to you about, right? You talked about those?
Yeah, but I'm fine. They don't bother me. I mean, I love to get them because it does something to me all over.
Okay. with this mic.
Well, I just know the way they make me feel, and a lot of you young ladies don't know what I'm talking about. But just keep living. Just keep getting that wake-up call and smelling that coffee, and I promise you it will happen. But the hormones that I get, I mean, they make me feel really good. I don't have the hot flashes anymore. I'm not irritable. I don't want to cry at the drop of a hat. And I want to hug my husband more, which he loves, you know. And it makes my hair grow. You know, now it grows in places I don't want it because I got a mustache. You know how you got a little mustache? You know.
Refocus. Close this thing on out. So the last condition is called androgenetic alopecia. It is female pattern hair loss, the most common type of hair loss among all women. And it happens at the top of the scalp as well, but not just there at the center, but just kind of all over what we call the frontal scalp. Increases with age, menopause, and it's influenced by heredity and hormone factors. So this is a nice little schematic of a normal hair, and as the hormone starts to affect it, the hair starts to grow finer and lighter over time until eventually the hair is so fine and so light that the anchoring follicle can't even hold it anymore and it just starts to fade away. A classification schematic here as well to kind of show the progression. This is a typical, they call it the Christmas tree pattern, where at the back it's really not as affected, but as you come toward the front of the scalp, the hair loss area flares out. A non-inflamed scalp, it doesn't really itch. It's kind of a silent disorder. You'll just notice more hair in the sink and a thinner appearance. This is a lady who started out with one problem, the androgenetic alopecia, and then she decided that she was going to stop perming her hair and have dreads, dreadlocks, locks, whatever. And so she did that, and then the weight of the heavy hair caused traction, and it just catapulted from one thing to the next. So for this, you know, you really should always have a scalp biopsy whenever you're having any kind of hair problem, because it can be difficult to tell clinically exactly what's going on. Plus, when you get a look at the scalp under the microscope, you can tell how far along it is and how you need to treat it more specifically. So if you send your friends or if you come to my office for hair loss, prepare to get a scalp biopsy. Anybody who does not give you a scalp biopsy and is evaluating your scalp is not evaluating your scalp thoroughly and is guessing at treatment. Yes? Scalp biopsy, right. Because everybody's fine when I say that. Until I say the word stitch, that's when everybody freaks out. But we take a sample of the scalp so we can get an idea of what's going on deep down. Because the problem is not the hair, right? The problem is the hair-making apparatus, which is the scalp. So it sounds terrible, but it's really not that bad. Me? I'm not going to answer that question. I don't have hair loss. All right. So topical medication, there are pills that you can take for this too. You can get successful treatment with this problem, at least to stop it. Most women do start to see hair thickening. There's this new genetic test that you can take to determine your chances of developing this particular type of hair loss. And that's an innovation that's just come about in the last few years. So any questions on that one? Other treatments for hair loss, laser max hair comb. Has anybody heard of this? Don't waste your money. It's $500 and it doesn't really work. Well, it's something you're supposed to do at home. It's a light source and you're supposed to wave it over your scalp and it doesn't work. Don't waste your money on that. Saw palmetto is an herb. Stem cells are something that's an emerging treatment. Okay, so the highlights, hair shapes differ by ethnic groups. We learned that tonight. Black hair does grow. It just achieves a steady state sometimes that allows it to break off faster than it grows. Diagnoses often occur together, so just because you have one thing doesn't mean you don't have something else. And a lot of times that will happen and will overlap the treatments to get better success. An itchy scalp should always be evaluated, even in the absence of a rash. And these are the questions that as dermatologists I think we still have to answer. Do chemical relaxers predispose to hair loss? We think that we know the answer, but we're not quite sure. Are patients with CCCA exposed to the insult early in life when the scalp is vulnerable? Is this something that's triggered early on and then just manifests itself later, like skin cancer? Are follicular stem cells lost? You know, everything is about stem cells now. And if stem cells can provide a way to regenerate hair follicles, wouldn't that be a wonderful treatment and better than hair transplant? Is there something about the structure of African hair that makes these patients more susceptible? So is there something about the way that it's anchored in the scalp? So a curly hair has a curly follicle, so maybe that has something to do with why this particular problem affects only one group of people. Is vitamin D involved? I started checking vitamin D levels recently because that was another parameter that we started to look at, and you know, it's a problem out here now with low vitamin D. We're finding different things are linked to vitamin D every day. Why is the prevalence of this of CCCA specifically so much lower in South Africa than America? Makes you wonder. You know, you would think that in South Africa they would be less likely to relax their hair and wear weave, but we know that's not true because they all look at America and this is what everybody wants to be. So, what is it, you know, about the African American experience that seems to make this problem so much more severe? And why does it always start in one place? I don't know, but I'll try to find out. And that's all I have. I'll answer any more questions if y'all have any.